From your experience, what are some best practices to apply during a virtual visit with a patient?
Well, you definitely want to make sure that the patient has a phenomenal experience, right? So you want to sort of use that as your starting point. Certainly telehealth is convenient, but you want to make sure that, connectivity issues are resolved and that there's a very seamless experience for the patient of getting into the video with the doctor, that they aren't, just staring at a wall or something, but they're, talking to a real person as quickly as possible. Um, and then, standard things like, look into the camera, engage with the patient. I also recommend that providers use a second screen. Oftentimes we're needing to interact with the patient's medical record. So we're needing to look at their medications, their previous visit. And so I'll have a screen over to the side where I can have that medical record open on the screen. And then you want to tell the patient what you're doing, what you're looking at. I mean, if you're referring to some papers down below you, or you're looking at a screen to your right, you just say, Mrs. Smith, I've got your electronic health record pulled up here on the screen to my right, so you'll see me looking over there. But you want to keep patients, sort of apprised of what you're doing. The other thing that can be really helpful is using photos. Sometimes the quality of video can vary, and so what I recommend is for certain things like skin conditions or even sore throats. Patients have a lot of them have a smartphone, and they've got a real high quality camera in that smartphone. Have the patient take some photos before the visit and send those in, or sometimes they can be uploaded during the visit. But those provide a really nice complement to the video interaction and give you as a provider more information. And so we find that a lot of times using photos can be helpful.